for joining today. It's really honored to be invited and be part of the seminar series that you have running out of the School of Population and Public Health. Thank you for the introduction, George. I just have the disclosure slide. I'm part of a community of practice in Ontario, and I like the way they just include it in every presentation. So just sort of disclosing where my research support comes from, who I receive honoraria from. These are for teaching, reviewing activities, or advisory board roles. No consulting, and then just that I am paid in salary from the University of Toronto. So I am a graduate of the UBC program. I was just saying to George that I started almost 20 years ago, which is quite shocking really to think about. But after I did do my master's at UBC, I did come back, or I came to Toronto, where I did my PhD and spent some time in the Netherlands during that process. And I then did a postdoctoral fellowship at the University of Alberta before returning to Toronto to work with Paul Demers at the Occupational Cancer Research Centre. And I've only been at the University of Toronto in a full-time sort of core faculty role since 2019. So just before COVID-19, November of 2019, I moved over. So yeah, I thought it might be helpful to just give a bit of a context there to where I'm coming from. In terms of the presentation today, what I really want to do is try and tell you a bit of the story of what a large group of us have been working on in Toronto as part of the Healthy Nail Salon Collaborative. And I'm going to touch on results from a series of projects that include some qualitative interviews, some surveys, training and development evaluation, and an exposure study that we did in Toronto salons, and then wrap up with some high-level thoughts and what comes next for this research program and community group that I've been active in for many years now. So I'm not sure how many people think of nail salons and the hazards that may be within their walls. I know certainly if you walk past a salon in a mall or on the street, sometimes the smell is quite potent, and some people can be bothered by that and others not so much. But it has gotten quite a bit of attention over the last 10 years. And I think it's fair to say that one of the most impactful mainstream media attention that came from the New York Times, which was a multi-part, long version expose that was published on the weekends, over several weekends. And that really blew the lid off of what was happening, at least in New York City. And there are certainly some commonalities with other big cities in other countries, even here in Canada. So it's definitely something that has been getting more attention. By way of background, there has been quantitatively quite rapid growth in the sector before COVID. There can be large volume salons. There's a lot of price point variation. So you can think of having, the many discount salons versus the higher end, more spa type services that are provided. But they are largely small businesses. They're often family-run businesses. And the technicians, the nail salon technicians, the workers who are providing the manicures and the pedicures are largely female. And within the discount salon portion of this sector, they're often new to Canada. It's often the first job that these women have held when they arrive. In Ontario, at least, we have no licensing system. They're often precariously employed, often misclassified. So they're not all employed in an employment relationship. They can be independent contractors. Some may rent space within a salon, things like that. So a little bit similar to hairdressers in that there are many different ways that they come to be working within a particular salon, and many different relationships between them and the owner of the salon. But certainly the technicians themselves have concerns around occupational health and safety, as well as the employment standards. And a key piece that I think I'll come hopefully full circle on is that from a public health perspective, really this occupational health and safety concern for the worker intersects with public health concerns around protecting consumers who may come into the salon. And this presents some challenges for the folks that are working in the salon in terms of navigating. And just to show you that I'm not I'm not lying about how many salons there are and the rapid growth. This is from actually, interestingly, immediately pre the declaration of the global pandemic of COVID, but there were about 1,500 licensed and inspected salons in the city of Toronto. And just pointing out that these don't include unlicensed salons or folks that are doing these services within their private residence, as an example. So certainly many small workplaces across the city. So I think we're going to go to the first poll question around the hazards that we might anticipate in these salons. So I'll defer to the hosts for that. There it is. Okay, so what hazards are likely to be present in nail salons as the first question? You can choose as many as you want there.
Victoria, the poll has ended and
okay,
the results are shared.
Thank you. Okay, so you can see that quite a high proportion of people thought that for each of those hazards might be present. And certainly that's how I feel as well. I think that all of those hazards are potentially present in the salon. So even though we think of it as sort of a caring environment, a service environment, it's not without hazards. For chemicals, we often hear about the toxic trio, which is toluene, methyl methacrylate, benzene. We think about sensitizers, we think about wet work. So a lot of hand washing, wearing of gloves. In biological hazards, these are those bacterial and fungal infections that the customers may bring with them into the salon unknowingly. The technicians are using a lot of vibrating tools. There's also artificial UV lamps that are in the salons for curing certain polishes and artificial nail products. And the image from the California Healthy Nail Salons group on the right-hand side showing sort of these awkward postures and repetitive motions that the workers are having to undertake throughout their workday. And certainly the psychosocial or psychological hazards are present. They can be very high volume, intense workplaces, not consistently, I would say, but certainly they have that potential, and they're having to navigate client expectations and manage client expectations and respond to customer complaints and things like that that can be very difficult, particularly when there may be a language barrier present between those two parties. So these hazards arise from the routine tasks that are being done in nail salons. So the most common are the manicures and the pedicures, where they're cutting cuticles or cutting nails, filing nails. They're doing massage with lotions and moisturizers. They apply nail polish, both traditional polishes and shellac polishes that require UV curing. And they apply artificial nails, which there's quite a wide range. You can't see my nails, but I don't frequent nail salons actually. But acrylics are the more longer, the brand or the product that has been around the longest, but there are also gel formulations and newer things coming out all the time. And in addition to all of this, these workers do a lot of cleaning and disinfecting of equipment that they're using in the salon, as well as cleaning and disinfectant of surfaces, you know, the pedicure baths, the manicure tables, things like that. So another potential source of chemical exposures from the cleaners and the disinfectants. And these exposures have been linked with health impacts. I think it's fair to say that the nail technicians or the manicurists have a higher risk of skin disease and respiratory problems compared to other workers. There are mixed or inconclusive results around reproductive effects and cancer in the long run, although in the case of reproductive and cancer, these are the things we hear from the workers in terms of their concerns. So they have exposures. They do seem to have a risk of diseases in variety of body systems. And this has led in a lot of different places to community organizing. And I'm showing you sort of a selection here from across the US. So there's a California Healthy Nail Salon Collaborative. There's initiatives in New York, in Michigan, and also in Boston. And the goal of these groups has really been to advocate for better, healthier, safer working conditions for those folks that are working in nail salons, and in some cases to advocate for regulatory change. And following in those models, there was the development of a similar community-based group in Toronto called the Toronto Healthy Nail Salon Collaborative. And it was founded out of the Parkdale Clean West Community Health Center in early 2014. And it stemmed initially from concerns that clients were raising in the community health center. Just for those that may not know, community health centers are a part of the primary care landscape in Ontario. They're community level providers that provide care regardless of your insurance status. So they take all comers and they do a lot of health promotion and primary care delivery. And they had clients coming in with concerns about their work in nail salons, and they had a very committed health promotion person there who took this and ran with it really, and reached out to researchers, to clinicians, to other community groups that she thought may have a shared interest. And it formally came together in 2014, and it's still ongoing almost 10 years later. It's involves many stakeholders who I'll show you on the next page. This is an earlier photo of many of the participants, with the goal of improving the health and working conditions of nail salons in Toronto. And so we've recently, I realized I didn't update this. We started as the Healthy Nail Salon Network, and we recently changed that to the Healthy Nail Salon Collaborative. But the membership has been quite dynamic over the years, depending on the organization, individual organizations, strategic initiatives, and sometimes just a case of the person's individual interests at each organization. But it has included, obviously, Parkdale Clean West Community Health Center. There's a nail technicians network that has developed in Toronto to try and bring the technicians themselves together and organize a little bit around advocacy and training and education. But we have a working women's organization, many of the settlement clinics in Toronto, legal clinics. The Canadian Environmental Law Association is one that I think many folks will be familiar with, as well as OCAL, the Occupational Health Clinics for Ontario Workers, and researchers like myself from the University of Toronto, the Institute for Work and Health, and Center for Research Expertise in Occupational Disease. And the collaborative has supported many projects that are led by different groups around the table. So there's no formal funding for this. Everybody is contributing within their role or with their own time. And folks have taken this in many different directions. And the ones that are bolded are things that I'm going to talk a little bit more about today, as these are the ones that I was most heavily involved in. So one of the first things that happened in 2014 or 2015 was we had a medical student as part of the group who was an undergraduate medical student and needed to do a determinants of community health project. And she had a family connection to the nail salon sector and was very interested in undertaking some qualitative phenomenological interviews with women. They were all 5 women who had worked in the sector at some point. And her work identified barriers to occupational health and safety practices, and she described these at the worker level, the salon level, or the nature of salon work, and then sort of these norms that will be familiar to everyone because we've seen them in other industries and other sectors. But certainly a couple of things that came out of Irene's work that were really helpful as we move forward was the emphasis that the nail technicians felt around the artistry and the caring aspect of their profession, that this was a job that they often really loved, and they wanted to be able to do it safely. But also from the norms, the feeling that these problems or these concerns were just part of the job and that they needed to just accept them. And in some cases that this was their first job in Canada and that they didn't feel, they didn't want to speak up, they didn't want to create problems, that they were already just very grateful to have the opportunity to be working and they didn't want to cause problems. The Nail Salon Worker Project sort of developed around the same time, and this was led by Parkdale Queen West as part of their health promotion program. And they worked with the nail technicians, they worked with researchers like myself and clinicians to develop training content. And when they had developed this, they then took it out into the community and they did peer-led training in salons in Toronto and in community settings, sort of outside of operating hours. And they've done that over 200 of those training sessions so far. And they've developed materials that are specific to skin hazards, respiratory hazards, reproductive health, and musculoskeletal problems. These are available online. The link is a bit unwieldy, but the website itself is very difficult to navigate. And they're translated into the major languages that we find in downtown Toronto, at least, but obviously there's a large diversity across the country and even across the GTA or the Greater Toronto area. And as they were rolling these training programs out, at the university side, we undertook an evaluation of the first set of training programs that focused on skin health or skin hazards. And as part of the community-based peer-led training, 3 surveys were administered. So they did one before the training workshop, one at the end of the training workshop, and another one 6 months later. And looking at the 6-month survey, which we felt was more useful in terms of long-term learning and changes in behavior, we did find that for these technicians that had participated in the training, that even at the 6-month time point, they had an increased awareness of the risk to their skin resulting from their work in the nail salons. They had an increased knowledge of the protective measures that they could use and increased use of those measures, and they had a better understanding of the health impacts that may result. And so this really helped to lay the foundation for expanding those workshops to doing different topics and to getting funding for Parkdale Queen West to continue doing that really grassroots community work in the salons in Toronto. And then from the research side, so as I am a hygienist by training, and there continue to be a lot of questions and concerns around chemical exposures in the nail salons. And so together with Lynn Holness, who's an occupational medicine physician in Toronto, we sought funding to do an exposure survey in some salons in Toronto. So I'll spend a bit more time on this particular piece, but we really felt that it wasn't just about chemicals. Even initially, we knew that we would be naive to focus just on that. So we did aim to characterize worker exposure to a range of hazards, and I'll show you that in a couple of slides. So we set out to recruit salons to participate in this. Now, so there's not really a list of salons in Toronto, and the technicians themselves are not licensed. There isn't an association, so often in other sectors, we have the support of the health and safety system and the health and safety associations, and those weren't available here. So we actually did door-to-door recruitment in Toronto, and Tammy Cuck, who is pictured on this slide, led a group of folks that went door-to-door. They had to go to over 200 salons, and we got 26 who agreed to participate and were able to complete sampling in 22 of them. And Sheila Kalenge, who's also a graduate of the UBC program, was the lead field hygienist on this work. And so Sheila went out to the salons. And as I said, we were interested in a lot of different things. So we collected active air samples as well as passive air samples. We collected wipe samples on the hands of the workers and commonly used surfaces. And I'll expand on this in a little bit. We also collected wipe samples from surfaces that we had contaminated with known products. So sort of positive control type activities. And in addition to these chemical exposures, we did questionnaires with the workers who participated, and we used the job content questionnaire to assess their job control and demand, job control and demands. We used the quick exposure checklist to get a sense of the ergonomic hazards. And we collected information on the services that they provided during the sampling period and took some observations about the salon environment. So we're going to go to the second poll question now. So what health outcomes do you think we were most concerned about when we had workers with exposure to acrylates? Okay, I can see that the polls ended. Is that correct? Yeah.
Yes.
Thank you. Okay, so so it looks like the have been shared as well. So yeah, we have the answer I was looking for was A and B, although I realized that it's the irritant contact dermatitis is probably not entirely incorrect, but certainly, and we'll close that and move on. But just thinking about acrylates, we are really thinking about allergic contact dermatitis and the potential for work-related asthma. So just pulled some information up on acrylates here. It was actually the allergen of the year from the American Contact Dermatitis Society, which focuses on allergic contact derm. And it is a dermal sensitizer. It has the DSEN notation in the ACGIH TLV book. When I dug in on this, actually, it's not an accepted respiratory allergen, though I think most folks who work with acrylates are thinking about respiratory allergy. It is also a respiratory irritant and could be responsible for both allergic occupational asthma as well as irritant-induced asthma or work-aggravated asthma, which is just the exacerbation of pre-existing respiratory issues in workers. So, the participants in the exposure study, we had those 22 salons, which I noted, and we had 56 workers participate. Some workers participated on more than one day. They were in their mid-30s on average, and they'd been working in nail salons for about 7 years. But they had quite a range of the number of salons they'd worked in, so anywhere from 1 to 10 salons, and they did work full-time hours on average. Some of the folks were working many, many more hours. You can see a maximum of 80 hours, and those tended to be the folks that were owners of salons who were also working in the salon. And we did do full shift sampling for the air samples, getting a fairly good average of over 7 hours of sampling each day. The workers were largely female, which I alluded to earlier. So, but a few men in these salons. Most of the technicians were providing manicures and pedicures, but less were providing artificial nails. In fact, we had a few salons we went into that didn't even offer acrylic nails. So they didn't like working with the acrylics. So they just didn't offer it as a service. And in terms of the respiratory symptoms, just showing you down at the bottom, so 15% of the participants reported cough and about 10% reported phlegm and less reporting wheeze. So those are fairly, no, they're not high levels of prevalence for a working population. So the wipe samples, which is where we were really interested in these acrylates, and this is work that Sheila has published. We did these wipe samples, as I said, on the workers' hands. initially, and we didn't detect any acrylates on their hands after providing services. They were all wearing gloves, so we did it after they removed their gloves. We also collected wipe samples. So we used a 10 by 10 centimeter by 10 centimeter template with a Z wipe pattern. And we did it on some commonly used surfaces. And again, we didn't find any acrylates on those work surfaces. Sheila was creative, and we did sort of wonder, well, is there any acrylate, do these products, do they have acrylates? And so there were a couple of positive controls, like places where we knew people had contacted the product. And so on those samples, when we did those wipes, when we noticed or the worker highlighted that they had in fact inadvertently or unintentionally contacted the product, we did detect a couple of the acrylates then. And we were very interested in whether the products themselves really had any acrylates in them. And so we can sort of contaminated surfaces and did the wipe samples there. And we did this a bit more frequently with 18 samples. And what we did see is that we could detect several different acrylates. So that's methyl methacrylate, ethyl methacrylate, and various variations of acrylates there. And you can see down in the table just showing you where the types of products that we tested. So largely they were polishes, but they were traditional as well as the shellac polishes that require curing. And then two at the third and the fourth one these are ones that are marketed as being free from particular chemicals, not acrylates generally, but they do have acrylates even though they're free of other chemicals in their formulation. In the air samples, I'm just going to sort of skim over our results because there's too much to dive into too deeply. But I will say we used passive samplers to quantify formaldehyde, and we detected formaldehyde in all of our samples. So there was formaldehyde in the air in all of the salons. The mean level or concentration was 26 parts per billion. So I just wanted to emphasize the units here. So it was parts per billion. We looked at the chemical concentrations in relation to symptom reporting, and we did see that the technicians who were reporting having bringing up phlegm from their chest did have higher levels of formaldehyde exposure, but we didn't see any other trends between the specific volatile organic compounds and any of the symptoms that folks were reporting. Interestingly, we also detected methyl methacrylate. So this is one of the acrylates. It's a monomer that after curing forms these polymers that are quite strong. And we detected the methyl methacrylate monomer in almost 2/3 of the air samples. It's interesting in part because methyl methacrylate is prohibited in cosmetics in Canada, but it certainly was common in our results to see it. Again, we're in the parts per billion range here. So the mean methyl methacrylate exposure was 342 parts per billion with a geometric mean down at 30. So skewed in the exposure, the concentration distribution. I will also say that even though the formaldehyde exposure seems quite low, in Ontario, we don't have a TWA. We have a STEL of 1,000 parts per billion or 1 part per million. But NIOSH, formaldehyde is a carcinogen. It's associated with nasopharyngeal cancer, and NIOSH has a recommended exposure level of 16 parts per billion. So when you consider the NIOSH REL, the majority of the samples that we looked at would exceed that recommended exposure limit that considers the carcinogenicity of formaldehyde. The other piece that we looked at was around phthalates and flame retardants. So one of the co-investigators on the study was Miriam Diamond, who's done a lot of work in this area and has a strong interest in passive sampling using sort of the silicone wristbands and silicone brooches that have become increasingly more common. So we did look at and quantify using the active samplers 10 phthalates and 19 of the organophosphate esters, which are sort of the replacement flame retardants, but they're also plasticizers. So both of these groups of chemicals we expected we might see partly due to the consumer products that are present in salons, but also the nail products themselves may have plasticizers to reduce brittleness and things like that. And we had fairly good detection on the passive samplers, the brooch and the wristband, less detection on the air samples, the active air samples that use the OSHA versatile sample. So it collects both the particle and the gas phase of these compounds. And I'm just going to highlight one of them because there's a lot of results there. This paper was part of a PhD thesis, Lynn Nguyen's thesis, and it's been published. This paper is out now. But what was surprising to us, so this is TSEP, just one of the organophosphate ester chemicals that we looked at. And there were a few of the organophosphate esters that were surprisingly high to us. So the work that we had done previously in electronic waste, we compared these nail salon samples, and in fact, the levels, again, the units are small, nanograms per meter cube, but the levels were higher in the nail salons than they were in several electronic waste facilities that we had looked at before, where we expect to see these organophosphate esters as flame retardants in the electronics themselves. So this was a bit surprising to us. Now, certainly these TSEP in particular may be in building materials. It may have been in some of the consumer products, but higher levels than we were expecting here. And on the ergonomics and psychosocial side, looks a bit busier than I hoped. Sorry about that. We had very high prevalence of musculoskeletal symptoms reported. So you can see that over half of the nail technicians reported neck pain, over 40% reporting back pain, and over a third reporting hand and wrist pain. So quite common to be having body aches and pains in this job. And that was confirmed by the results from the quick exposure ergonomic checklist, or the QEC, that we did, which is the bottom right-hand corner, that showed the highest ergonomic hazard was for the neck region in doing the manicure and the pedicure tasks. And in the job control questionnaire, where we looked at job demands and job control, in fact, what we expected to see was that we would have nail technicians with high demands and low control, so falling into this high strain category. But in fact, just over half fell into the passive category, where they felt there was low demands, but also very low control. We have looked at this in relation to the symptom reporting, and this high demand does seem to be folks with high demands have higher reporting of symptoms, particularly the musculoskeletal symptoms. And this data is still being analyzed, but hopefully will be published forthcoming. So the main findings really from this fairly big study, we really found that there's diverse exposures. There are many health and safety concerns, and that we do absolutely need to think about more than just the chemical exposures for these workers. The exposure for the VOCs was very common at relatively low levels when we compare to other, industrial or traditional occupational settings, with a couple exceptions. And I think the formaldehyde one is worth highlighting because we have this NIOSH recommended exposure level to consider. I think importantly, although there's a lot of talk about acrylates, in the workers that we sampled, we didn't find any skin contact or skin contamination with the acrylates, but the products certainly did contain them. And we did find methyl methacrylate in the air in the majority of the salons as well. And as we were completing the exposure study, we were interested in hearing from a wider group or a larger group of nail technicians. And so one of the MPH students, Sadaf Sanat, went out and did a survey in salons in Toronto. So she similarly went door to door, and she went to 66 salons and had over 150 nail technicians complete an anonymous survey, a paper-based anonymous survey, just while she was there in the salon. And it was reassuring in a way that she continued to see very common musculoskeletal complaints among the nail technicians. And for all of the symptoms, both the skin and the respiratory and the musculoskeletal, most of them were being reported as related to work. So that's a symptom that improves on weekends or when you're away from work. So definitely confirming that the nail technicians are feeling like the work is negatively affecting their health. If we could go to the last poll, please. Thank you. Okay. I think the poll is closed now. Is that correct? Yeah.
Yes.
Okay, thank you. So yeah, 73% have said that it's false, and that is true. So the products, many of the, I shouldn't say all, but many of the products that are being used in nail salons are exempted from GHS or WMIS here in Canada. And so the result is that a lot of the things, when we're thinking about chemicals, a lot of the products being used don't have information on the label that is helpful for the workers. So cosmetics are exempted and they're defined under the Food and Drugs Act. And then things that are manufactured for consumer use or personal use are defined under the Canadian Consumer Product Safety Act. And so the reality is that a lot of the polishes and things that are being used are manufactured for personal use, sort of things you would use at home. And inherent in that a little bit is an assumption that you're doing it periodically. So they're not really thinking about the folks that are using it day in and day out at their workplace. And even the labels that are on the products, because they vary, but there is information on the labels, but often the marketing labels are not always accurate. So I alluded earlier to the labels that talk about being free of, and so you see 3 free and 5 free and 7 free. And so it's a marketing tool where they're claiming to be free of things like the toxic trio. And there is good evidence from Ceballos et al., as well as the California EPA, that have tested products that make these claims. And the labels are, in fact, not always accurate. So the information is not there. And when it is, it's not always great. So there's a challenge for the workers in understanding what they're using and what's in the products they're using. Now, certainly there are things in the workplace that would be required to have WMIS labels, and this may include things like cleaning and disinfectant agents. And when we talk to the nail technicians, anecdotally, certainly we hear that these SDSs are not always available or they're not accessible. So they're written in English and French as required, but certainly that is not always an easy language for the workers to be able to read and understand what they're supposed to do. So I'm watching the time and I'm getting near the end. I think some of the high level challenges that we've encountered in this work that we've been doing, both as researchers and in partnership with the community and the Healthy Nail Salon Collaboratives. One of them has been this intersection between occupational health and safety and public health. And it connects to the second bullet point there, which is the regulatory burden on small businesses. So Tiffany Liu is a master's of public health graduate from U of T, and she did a bit of work for me in the fall, just thinking about, so if you want to open a nail salon, what are all the things you need to do? And it is fairly overwhelming, all of the connections that these small businesses need to make in order to get all of the information that they require. And certainly in Toronto Public Health runs a body safe program, which is analogous to the food safe program, where they inspect the licensed salons. They're supposed to do it once a year. COVID has disrupted that. But that's the body that the nail salon owners are most familiar with, and the inspections that they're most familiar with. But those inspections focus on protecting the customer. They don't focus on protecting the worker. And so they focus a lot on infection prevention and control. And they don't consider other exposures, and they don't always consider sort of the safe handling of the cleaners and the disinfectants that they're being asked to use. I think another thing that has come up a lot with the Healthy Nail Salon Collaborative, and as we get results, is sort of this underlying challenge of not wanting to impact employment opportunities for women who are new to Canada, wanting to make things healthier and safer, but not removing these employment options altogether. And that's, obviously there's different views around the table, and this has been a challenge for us to navigate at times. And something that we're thinking about more and more is this connected to that, I think, the intersection of our health and safety concerns with sort of cultural beauty standards. And this is way outside of my area of comfort, never mind my area of expertise, but why these salons exist, and they're part of this beauty culture, and the beauty culture itself may be making people sick or contributing to illness. And so it's very complicated to have these discussions about changing how we do things or changing products, doing things less frequently. Those types of things can be pretty challenging. And a piece that's become more and more that I understand more than I ever did is the interjurisdictional challenges of this. So at the federal level, there is definitely a role around chemicals management, particularly for these consumer products and cosmetics. We still have the traditional health and safety landscape at the provincial level. And then locally, we have Toronto Public Health that's really concerned with the customers and infection prevention and control. So there's a lot of moving parts, and it's very difficult to get everyone at the table to talk about some of the challenges and the findings that we have. So what we have done with the results is we've incorporated them into the training programs, particularly into the prioritization of topics to develop training for. The results from many projects have been used to support further funding for community education and training, largely based out of the Community Health Center. But I think we still feel pretty strongly that we need to improve the understanding of the hazards and the regulations that apply and don't apply, and the prevention strategies that could be used in salons. There's definitely a disconnect between scientific understanding and awareness at the workplace level. And locally, we really do want to see, we'd love to see more coordination between the public health system and the occupational health and safety system. In other jurisdictions, things have been done. So certainly other places license nail salon technicians, not the same as a formal apprenticeship, but they require a license for people working in the space. The expose from the New York Times that I mentioned certainly led to fairly fast top-down regulatory changes around training, and as well as things like salon ventilation at the state level. In California, it's been a little bit different. It's been more bottom-up, and they have had a community initiative to encourage healthy salons. That is a voluntary program where salons can sign on to be certified as a quote unquote healthy salon, and their criteria are on the right there. So there's many ways to approach this, and certainly in Toronto, we're taking a more bottom-up community-led approach. And I think I would be remiss if I didn't point out that COVID-19 has sort of really impacted this sector. In Ontario, it was closed, I think, the longest. The personal services sector was closed the longest out of all of the workplaces. In the salons in Toronto, it led to a really sharp increase in anti-Asian racism as the pandemic was starting. And once the salons reopened, there's been a lot of job losses, salon closures. So I showed you that map of 1,500 salons. It's much less currently. And we think that people have shifted where they work out of the salons and into other sectors. And I wanted to provide this link because a group that I'm not affiliated with, but at the Ontario College of Art and Design, did a photo voice project with nail salon technicians to sort of narrate what their experience was like during COVID-19. And looking ahead, we are continuing this work, and we've received funding from SHRC to look more at the intersection between work and health and anti-Asian racism, with a fairly strong connection to COVID-19, and looking at employment trends and nail salon experiences, and making the training products that have been developed more broadly available. We have lots of things ongoing in salons. Of an undergraduate student doing some spatial measurement mapping with a direct reading instrument. And working to get funding to expand the occupational disease surveillance system to include more women's health outcomes with Paul Demers and Giovanna Sritharan at the OCRC. So I think there's lots more to come in this space, and we're very excited to see where it leads. So I think I'll just stop there and say thank you all for listening. These are the funders and main drivers of this work, but certainly it's been a real team effort over the last 10 years.